Hey all! This is a listening video for students who are struggling to speak English and for those who are trying to pass occupational English test. Good practice and expert guidance is needed to fulfill each one's dream. Students, stay at home safely and listen this video carefully. What is the difference between the coronavirus and COVID-19? A coronavirus is a type of virus. There are lots of common coronaviruses, which are basically just forms of a cold. It causes COVID-19, a disease. The 19 signifies 2019, the year when it started. The two terms are used interchangeably in conversation, but actually mean slightly different things. What does the virus do to my body? In the beginning, the coronavirus seemed like it was primarily a respiratory illness. Many patients had fever and chills, were weak and tired, and coughed a lot. Those who seemed sickest had pneumonia or acute respiratory distress syndrome, which caused their blood oxygen levels to plummet, and received supplemental oxygen. In severe cases, they were placed on ventilators to help them breathe. By now, doctors have identified many more symptoms and syndromes. And some people don't show many symptoms at all. In April, the CDC added to the list of early signs sore throat, fever, chills and muscle aches. Gastrointestinal upset, such as diarrhea and nausea, has also been observed. Another telltale sign of infection may be a sudden, profound diminution of one's sense of smell and taste. Teenagers and young adults in some cases have developed painful red and purple lesions on their fingers and toes, nicknamed COVID toe, but few other serious symptoms. More serious cases can lead to inflammation and organ damage, even without difficulty breathing. There have been cases of dangerous blood clots, strokes and brain impairments. What are my chances of getting sick? It's a moving target, and depends a lot on where you live and when. If you're somewhere with an outbreak, you're at higher risk. If your state is reopening and cases are climbing, your risk is highest. Lots of factors determine how sick you actually get. Younger people tend to do better than older people, and having underlying conditions increases your risk. And if you were exposed to a lot of the virus, as many essential workers were, you have a higher risk of getting a severe case. Black and Latino people have been disproportionately affected by the coronavirus in a widespread manner that spans the country, throughout hundreds of counties in urban, suburban and rural areas, and across all age groups. However, a better question might be what your chances are of getting someone else sick. People in their 20s, 30s and 40s account for a growing proportion of the cases in many places, raising fears that asymptomatic young people are helping to fuel the virus's spread. Most people have a low chance of getting a severe case. But if you're not careful, you have a very high chance of infecting someone who is vulnerable. It's sort of like drunken driving. You could harm yourself, but you could also harm other people, too. That's why we don't do it. If I am sick, how will I know? If you've been exposed to the coronavirus or think you have, and have a fever or symptoms like a cough or difficulty breathing, seeking medical advice is the best option. They should give you advice on how to get tested and how to seek medical treatment without potentially infecting or exposing others. The Centers for Disease Control and Prevention says that if you're sick or think you're sick, but only mildly ill, you should isolate yourself, and you shouldn't leave your house except to go to the doctor. But a lot of people get the coronavirus without showing many, or any, symptoms. That's why you should always wear a mask outside your home. The only surefire way to know you don't have it is to get a test. And tests are still not reliable. How do I get tested? How long do tests take to come back? The situation is constantly changing, and each case is unique. One thing is consistent across the country, though: testing is a mess. As of July 28, the number of daily coronavirus tests being conducted in the United States is only 38% of the level considered necessary to mitigate the spread of the virus. People take a test, only to get results days, a week or more later. That's too long for most people, especially those who cannot quarantine even if they wanted to. Other countries are doing a lot better. Why? Well, fax machines are a surprising bottleneck. Temperature checks don't say much, because lots of people have the coronavirus without a fever. And even once you get results, they may not be reliable. If you want to get tested, prepare for a sore nose and a long wait time. What precautions do pregnant people need to take? This is, though, probably a stressful time to be pregnant, especially since there is so much that's still uncertain. Here's what we know. Pregnant people might be at increased risk from severe illness from COVID-19. According to the CDC, pregnant people might also be at risk of interruptions to their pregnancies, such as a preterm birth. And a study of pregnant Black and Latino people in Philadelphia shows they have an increased chance of being exposed to coronavirus, which bolsters other research showing that the coronavirus disproportionately affects Black and Latino people. Experts are cautiously optimistic that the coronavirus won't alter fetal development, although one study found strong evidence that a baby was infected with the virus in the womb. A more common concern is that the parent carrying the child is at increased risk of suffering complications if infected. The CDC has a really comprehensive FAQ that will be worth a look. What about using mask at this time? The coronavirus clings to wetness and enters and exits the body through any wet tissue, your mouth, your eyes, the inside of your nose. That's why people are wearing masks and eye shields. They're like an umbrella for your body. They keep your droplets in and other people's droplets out. But masks only work if you are wearing them properly. The mask should cover your face from the bridge of your nose to under your chin, and should stretch almost to your ears. Be sure there are no gaps. What should I consider when choosing a mask? There are masks everywhere. There are N95s and respirators, homemade masks and bandanas. Respirator valves should be avoided, but they do look cool. There are a few basic things to consider when you're wearing a mask. Does it have at least 2 layers? Good. If you hold it up to the light, can you see through it? Bad. Can you blow a candle out through your mask? Bad. Do you feel mostly okay wearing it for hours at a time? Good. The most important thing, after finding a mask that fits well without gapping, is to find a mask that you will wear. Every brand in the history of clothing, it seems, has entered the mask market. Spend some time picking out your mask, and find something that works with your personal style. You should be wearing it whenever you're out in public for the foreseeable future. Why is 6 feet away the right distance? The coronavirus spreads primarily through droplets from your mouth and nose, especially when you cough or sneeze. 6 feet has never been a magic number that guarantees complete protection. The CDC, one of the organizations using that measure, bases its recommendation on the idea that most large droplets that people expel when they cough or sneeze will fall to the ground within 6 feet. But some scientists have looked at studies of airflow and are concerned about smaller particles called aerosols. They suggest that people consider a number of factors, including their own vulnerability and whether they are outdoors or in an enclosed room, when deciding whether 6 feet is enough distance. Sneezes, for instance, can launch droplets a lot farther than 6 feet, according to a recent study. It's a rule of thumb, you should be safest standing 6 feet apart outside, especially when it's windy. But keep a mask on at all times, even when you think you're far enough apart. Does the virus live in clothes and hair? Probably not. If you are practicing social distancing and making only occasional trips to the grocery store or pharmacy, experts say that it's not necessary to change clothes or take a shower when you return home. You should, however, always wash your hands upon entering your home. The same advice goes for head and facial hair. If you practice social distancing and wash your hands frequently, you probably don't need to worry. Can hydroxychloroquine treat the virus? There has been a lot of talk about hydroxychloroquine, a drug used to treat malaria and autoimmune diseases like rheumatoid arthritis and lupus, but a National Institutes of Health panel has specifically advised against using the combination of hydroxychloroquine and the antibiotic azithromycin outside of clinical trials. A study of the records of 368 patients in the Veterans Affairs system, which has yet to be peer-reviewed, found that hydroxychloroquine, with or without azithromycin, did not help patients avoid the need for ventilators. And hydroxychloroquine alone was associated with an increased risk of death. The study was not a controlled trial, and patients who received the drugs were sicker to begin with. The authors wrote, "These findings highlight the importance of awaiting the results of ongoing prospective, randomized, controlled studies before widespread adoption of these drugs. What can I do to stop the spread? Wear a mask and stay far away from other people." That's it. That's the tweet. What are super spreaders? A super spreader is someone who is really good at passing on the coronavirus to others. The good news is, they're rare. But super spreaders exist. Can I hug my friends? It is risky now. A few tips for lowering the risk further: wear a mask. Do it outside. Turn your heads away from one another, no cheek to cheek, dear. You don't want to breathe into each other's faces. Wash your hands afterward. Of course, if you're really worried about it, you can make a hug glove with a clear tarp with sleeves. It's like an umbrella for your entire body. Thank you, Miss Sarah, for your valuable time with me to share these points regarding coronavirus. Thank you, Miss Green. Thank you for listening our video. Please like, subscribe, share and comment. All the best for all students.